まず大規模イベントと地球規模健康危機管理に関する WHO 協力センターのライアン・マクロスキー英勲爵士にご講演をお願いいたします。ブライアン先生、どうぞご登壇ください。マクロスキー先生はロンドンスクール・オブ・ハイジーン&トロピカル・メディスンの教授を務められております。オリンピック・パラリンピックにおいて2012年ロンドンでは公衆衛生サービスチームを指揮いたしまして、2016年リオでは公衆衛生顧問を務められております。2013年公衆衛生分野における功労により英国王室から爵位を授与されております。詳細なご経歴はお手元の36ページ、英文は74ページになりますが、ご参照ください。本日はオリンピック・パラリンピックの開催は主催地の健康増進をもたらすか、2012年ロンドンオリンピック・パラリンピックの教訓と題しましてご講演いただきます。時間がタイトなことがありますので、この貴重講演は申し訳ありませんが、フロアからのちょっとご質問はお受けできませんので、よろしくお願いいたします。それでは、マクロスキー先生、よろしくお願いいたします。
Thank you all for coming, and could I also thank the organizers, the Japanese and Tokyo Medical Associations and the Takemi Fellowship, not just for inviting me to be here, but for the generous hospitality that I've received in Tokyo, so arigato. And actually today I have to say is a good day for me to be talking about the Olympics, because Team GB have just won a gold medal in Pyeongchang. And winning gold medals in Winter Olympics is not something GB does very often. I just want to start with some key messages. The first one is that Tokyo should be preparing now to ensure that 2020 Games are successful, safe and healthy. But that's not new. You know that. You're doing that already, and you did it again before in 1964. So my second message is that beyond running the Games, you should think about a bigger ambition for what you want to achieve from 2020. And that's about planning for what happens after 2020 and the legacy that you leave behind. You need to look beyond the basics of providing the healthcare and the safe environment and organising the Games well to see what can you achieve for the people of Tokyo and Japan as a legacy from the Games. It is possible to do that, but you have to start doing that today, because tomorrow you're going to be very busy. And I remember a meeting in London in 2009 when we were looking at what had happened in Beijing in 2008. And they told us then, you need to plan your legacy now, because when the Games approach, you get so busy, you will not be able to think about the legacy. So the challenge is to manage to do that now, keep some legacy ambitions and make them happen. So there are some particular challenges in running a mass gathering event like the Olympics. Complexity and scale. The Olympics are a huge event. They're very big, they're very difficult to organize, and it requires a huge amount of organization. And while you're doing that, the politics of the Games become important, and we've seen a hint of that already this afternoon. But once the Games become a reality, and Japan's national reputation is at stake in making sure the Games are healthy and safe and successful, it means that political interference will make life more difficult. But that also means that that political interest is an opportunity that you can capitalize on to attract more attention to the public health aspects. Similarly with the media, who will be here, largely here to report what happens on the sporting field, but also here to report on what goes wrong. And as we've seen recently from Pyeongchang with the norovirus outbreak, things that are relatively, in some ways, insignificant can escalate very fast into being a crisis that appears on the front page of national newspapers around the world. It's also an issue that there's new partners involved that are not normally working in the health sphere. One of those is here in terms of the organising committee, but you also have to think about the sponsors of the Games. And if you're working towards, for example, an obesity target and an obesity strategy, having partners in Coca-Cola and McDonald's brings its own sort of challenges. There's also a particular issue for the Olympics and the Paralympics, is that the focus is often on the health care for the athletes rather than on the public health issues. And we need to bring that public health back into focus if we want to achieve a legacy. So in 2012, we had a number of things. I just want to focus on the first and the last points in this slide. The most important thing is to start getting public health at the table, discussing, say, not just the healthcare, the hospitals, the ambulances, but discussing the public health issues that come with Olympic Games and which make up the legacy. It's about making public health a political priority through the Games. And then when you've gone through the work, it's looking at identifying the opportunities that you can then bring from that. The opportunities that arise from having the Games, the opportunities that arise from the political interest that the Games create. There's two things I feel strongly about. One is that mass gatherings are an opportunity for health system strengthening, and they should be used as such. The second is that we see around the world that emerging countries are increasingly looking to use mass gathering events, sporting events, to signify that they've arrived on the world stage. And one of our aims after London 2012 was to provide the expertise to other countries to allow them to capitalise on mass gathering events so they can achieve the health system strengthening benefit. And I hope that Tokyo will do the same. And to look wider than simply organising the Games, but look at what you can do both for Tokyo, for Japan, and for the world as a consequence. So some of the opportunities that we looked at for London are listed on the slide. I'm not going to tell you what the opportunities for Tokyo are. They're for you to decide what you want your legacy to be. I can't help but comment at least on the tobacco issue, because it is such an issue. And I think London went to be a smoke-free city before the 2012 Games, but we used the Games to reinforce the message and to carry on the progress towards making London an entirely smoke-free city. I like coming to Tokyo. I'm impressed when I come, but I'm surprised. I'm surprised that smoking is so obvious and so visible in a city like this. And the issue is not just about passive smoking. It's about the visibility of smoking as being a normal activity. And where you have smoking seen as normal activity, your children will follow, and the generations to come will follow, and they will smoke. So I think the tobacco control issue is one you cannot avoid. It is your decision, it's your politics, your politicians, but you need to confront the issue and decide what you want to do. There's another issue which I think will be important for you, which we heard about earlier this morning and yesterday, which is how does the Olympics fit into an ageing society. And we will hear more about that from Uzaki-san later on, but I think what we heard this morning, for example, earlier, about the importance of social participation for an ageing population, and the Games are a time when you can generate a community spirit. And I think you need to think about how can you use that community spirit to engage your population, get the community involved, and make things better. And I think one of the themes that we had for London was not just to focus on the sport and the physical activity, but the concept that 2012 was a special year for London, and we should do special things, and they should have a lasting memory. And I think that's one you should possibly think about as well. We heard quite a lot this morning, several times the mention of how Takimi Fellowship changed my life. I think perhaps the ambition for your Games could be that 13 million Tokyo people stand up and say, Tokyo 2020 changed my life. Keto this morning mentioned the importance of having some financial arguments. This is one we used in London. If every primary care doctor in London managed to get 2 inactive patients to become active every month, that would save the health service in London some £7.8 million a year in reduced health costs. If you also factor in the reduced social impact and loss of work, the potential saving could be 60 million from a very simple intervention in primary care to promote physical activity. Our Go London strategy had 3 main themes to it. We focused on working with the population to make them more active, but we also focused very much on the National Health Service in London, both as one of the biggest employers in London, but also as a role model for the rest of the population. And we did very intensive promotion of exercise to doctors, nurses throughout the health service, so they in turn became examples for the population. And the Games inspired is this thing about saying 2012 is a special year. So they're activities that were not just to do with the sport or the Games, they were to do with saying London is a special place in 2012 and we will do things that will make a difference for the future. and that created some activities I'll talk about. Sexual health is an important theme, and we had a range of activities, not just again within the Games, but around London throughout that summer, where there was parks, parties, big screen events in preparation for and during the Games. And we used those to do sexual health education programs, provide contraception advice and sexual health testing. We provided HIV testing to allow people from countries who don't normally access it to use that during their Games. We provided hormonal contraception, and we developed those services across London for the population, and they continue currently. And during those party events, the big screen events, we also had HIV prevention outreach workers working to promote those messages. People will be familiar with the Games makers, the volunteers that we used across London for the Games. But one of the initiatives we did with them was to train a large proportion of those in cardiopulmonary resuscitation. So we now have a cohort of people across London who can respond to an emergency heart attack much quicker. And that became part of the ethos of our volunteering program that led to people being better able to contribute to their community after the Games. We had a child immunization program and a best breastfeeding initiative, both based on this theme that 2012 is special. So every baby, every child in 2012 should be given the best possible start. And that included an immunization program in partnership with the pharmaceutical industry. So these are things where we use this community spirit that will happen in Tokyo in 2020 as a means to improve life. The legacy we look at under three different categories: the infrastructure, better health choices, and better cross-agency working. The infrastructure is about what we put in place during the Games that we managed to continue after it. It does include quite a lot in terms of healthcare facilities, extra ambulances for the health service, etc. It also includes improved public health services, where we had to put in additional communicable disease surveillance systems for the Games, and we kept them on as part of our core services after the Games, and they're still running. We put in extra microbiology diagnostic testing for the Games, and again, they are now part of the routine provision across the health service in the UK. And we tested our response system for major outbreaks and for incidents, both in the hospital sector and the public health sector. All of that testing and preparation strengthened our ability to respond to other events, including terrorist events since then. We also have the wider community, where the physical facilities, the Olympic Park, was closed down shortly after the Games to be refurbished and reopened, and some 10 million people have used the park since. The major venues in the park, the main stadium, the velodrome, the swimming venue, are all still in use. So you can go to the Olympic Park in London, you can hire a bicycle to cycle round the park, then you can trade that bicycle in for a racing bicycle and take a turn around the velodrome if you choose to do so without breaking your neck. You can also now, the public can walk into the Olympic swimming pool, and for £5 they can swim for half an hour to an hour in the Olympic pool. So all of those structures are still in place. The Athletes' Village is now a home to 6,000 people in a part of East London that used to be quite derelict. And the polyclinic that we built to look after the athletes' help is now the main primary care centre for that community. In terms of better health, we have invested substantially in new facilities around London for exercise. But the particular point I want to highlight in this slide is that it changed attitude to disability, particularly from Paralympics. We have more disabled people taking activity in London than before. We also have more women taking part in sport and more ethnic minorities taking part. So we were very much tackling the equality and diversity agenda through our legacy in London 2012. We also had the community volunteering approach, which continued. We now have a large group of people across London who see volunteering in their community as a positive thing to do, and that in turn generates a positive attitude to health and other things. And as a consequence, London was voted the European Capital of Volunteering in 2016. But it's also about the other things that we did. At a community level, we looked at new partnerships, new ways of working across our local authority and our communities, including this partnership with Sanofi for the immunisation programme. And that has helped develop different ways of thinking across local government and different approaches to improving health. But the national one is the one I'm most interested in for you. This was about, because we did so much work across governments, across government agencies, to get the Olympics ready and healthy and safe, it improved the way in which government departments worked together. It improved the way in which we looked at, for example, funding for sport in the context of what it can do for health. That has helped us move on from 2012. So when we looked at developing a national physical activity strategy for the UK, a national obesity strategy, we were able to do much more work with, for example, the Ministry of Transport, about how you design transport systems in cities that encourage people to walk or to cycle rather than to drive. It allows us to work with communities and local government by building community parks, ensuring that housing developments have green areas, recreational spaces, that we can use to improve health. So all of that cross-government working is a reflection, again, of something Keizo Tameki mentioned this morning, which is how do you get the Ministry of Finance engaged in this work for universal health coverage. So we believe that the London 2012 Olympics has allowed us to improve the way government looks at health. It improves the way in which different agencies can cooperate to look at new ways of improving health for the population. So the question was, can the Games improve the health? The answer is yes, they can. But you have to plan it, and you have to start planning it now. You need to think about what you want the legacy from Tokyo 2020 to be. You need to start thinking about it, writing it down, and thinking through clearly how you will deliver that. And one of the challenges is doing that at a time when you're also trying to do all the work to make the Games safe and successful. Another challenge is, how do you measure it? And I really would encourage you to think about how you can sit down now, do some baseline planning, for example, for physical activity across the population in Tokyo, and how you'll measure any improvements. It has been one of the failings of mass gatherings in the past that we have got distracted by the urgency of doing the Games and missed the opportunity to do the planning of how we'd measure the benefits that's achieved. And perhaps that's a role for the medical associations, for the Tokyo Medical Association, for the Japan Medical Association, and indeed possibly for the Takemi program, to look at how can the medical world help the organizing committee and others to plan the legacy at a time when the organizing committee is fully engaged in trying to make sure the Games happen safely. There are opportunities to do that, and I would welcome some thoughts from you about what Tokyo can do to ensure that this happens. Arigato.
マクロスキー先生、ありがとうございました。大変ロンドンにおけるレガシーのお話、それと今から何をしなきゃいけないか、またいくつかの本当に資産と貴重なお話をいただきました。